Hi friends, this is Dr. Abdequaem Chimthanawala from Grace Healing Homeopathy. Today, again I will discuss one of my case, which remedy I prescribed and then tell you the mathematics of that remedy. वही जो रूटीन मैं फॉलो करता हूँ कि मैं मेरे क्लिनिकल एक्सपीरियंस केस में से आपको सिम्टम बताता हूँ और फिर वो सिम्टम पे और कौन सा सिम्टम की रेमेडी उसके अंदर आती है वो हम डिस्कस करेंगे कि जितना क्लिनिकल हो सके मैं कोशिश करता हूँ बिकॉज मैथमेटिका और रेपिटरी आपके पास बहुत सोर्सेज है पढ़ने के लिए सो आई बी मोर क्लिनिकल इन माई अप्रोच. I had a very interesting case, of pain in the chest and acidity. The patient kept on complaining about acidity. I have a lot of acidity. I have a lot of acidity. Endoscopy was done and MRI scans were done. Everything was normal, but the patient always had one symptom: acidity, 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 and pain in the chest. He was and this was for the past 5 to 6 years, my dear friends. This patient had a very secure job, a permanent job in a college. Very good in doing his job, very diligent in doing his job, doing that job for the past 5 to 6 years. But this symptom of acidity, and pain in the chest, what's there? He took lot of antacids, lot of tests, lots of medicine, all pathies, nothing would help the patient. This patient has a very interesting symptom. The patient said, whenever a work is given to me in the school, I get very tensed. What will happen? How will I be able, मैं काम कर पाऊंगा कि नहीं? Will I be able to do that work properly? And how the work will be completed? What will people say? And so on and so forth. In spite of he be doing the work for 5-6 years, but there was a lot of anticipation, and that caused a lot of acidity, a lot of pain. So he had to take a lot of antacids, because of that. Or he said, whenever there is a school function, maybe a celebration, people have scored good marks in 10th, 12th, or in their BSc or Independence Day, Republic Day, I get, when there's a lot of excitement, also I get acidity and pain in the chest. And he keep on complaining, pain in the chest, pain in the abdomen, and pain in the stomach. So much so the pain had increased, maybe a lot of stress had increased, that he said that I fear that if even somebody touches my chest wall, I feel pain in the chest. He had done his ECG and TMT, everything was normal, and doctor said there's a lot of stress. You don't take stress, your acidity will work it. Till then you can take one antacid and keep taking it. He came to me. वो मेरे पास आया and I also prescribed medicine. After taking the case for 1 or 2 months, there was no change. When I was reading this remedy, the case, I came across few symptoms, on particular symptoms, that pain in the chest from anticipation, pain in the chest from excitement, so much so that the patient had fear touching the chest wall also. And when I was reading Mathematica, I came across a very, very infrequently used medicine, and that is Strophanthus sarmentosus. Yes, Strophanthus, Sarmentosus, Sarmentosus. To my surprise, when I prescribed Strophanthus 200, next week I called the patient and he came and told me, sir, for the first time in span of 5 to 6 years, 5-6 साल के अंदर ऐसा हुआ है, एक हफ्ते तक मेरे को कोई एसिडिटी नहीं, कोई चेस्ट पेन नहीं, कुछ नहीं हुआ है. आप वही दवाई दो, प्लीज गिव मी द सेम मेडिसिन. And to my surprise also, because for the first time I had given this remedy in this type of complaints, my dear friends. And this is the importance of reading Materia Medica. This is the importance of reading every day, either repertory or Materia Medica, whatever you like. हम एक स्टूडेंट रहते हैं till life in homeopathy. You are always a student for life. This concept you must always keep in mind. And this patient, if you understand this, he had also told one symptom that जब भी मैं नीचे झुकता हूँ, whenever I bend down, मेरी छाती बहुत भारी लगती है. I have a lot of heaviness of chest, and this is also covered in Strophanthus. So the symptoms which I took for prescription were pain in the chest from anticipation, pain in the chest from excitement, fullness of chest from bending, fear of someone touching the chest wall, also present in Strophanthus. Now, as I was reading Strophanthus, I got to know few symptoms of Strophanthus which I would like to share with you, because otherwise you will not be able to prescribe these medicines, my dear friends. Pain in the abdomen, umbilicus, better by bending backwards. पीछे जब पेशेंट जाता है तो he feels better, and I know everybody knows this remedy. Pain in the abdomen, better by bending backwards. We all know this remedy, but very few must be knowing that Strophanthus covers this symptom also. Most of us know diascoria. One symptom very important. Again, one symptom, that pain in the stomach. You can tell gripping pain or cramping pain, but amelioration from pressure. Very, very important, my dear friends. Amelioration from pressure. One symptom which I have seen in Strophanthus and prescribed also in this symptom is nausea. Eating food aggravates. Nausea after eating aggravates. Of course, this is present in lot many of remedies, like we have Naxomica, Pulsatilla, Cocculus, Ammonium carb, Stannum, but it is also present in Strophanthus sarmentosus. One symptom you must remember of Strophanthus is odor of the urine is fruity. Like in diabetes, you must have never prescribed Strophanthus. So fruity odor is also present, is one of the symptom of diabetes, but of perspiration. But fruity odor of urine, Strophanthus. Please add one more symptom, which I think you must have heard this, but in some other remedies, that is odor of the urine is like horse. Horse odor of urine. Go in your Remedica, read it, and you will get one more remedy of this horse odor urine. So my dear friend, this is in short a case of Strophanthus sarmentosus and the symptom and the case which I have cured with this complaints. I had given the patient Strophanthus 200, repeated twice, and for the 3 months the patient is coming now with no acidity, no complaints and no repetition, but he keeps telling me, please give the same medicine which you have been giving me till now. This is in short, my dear friends, Strophanthus sarmentosus. I hope you like this video and you increase your knowledge of Remedica and sometimes rare remedy which we have not read. That's why it is rare. Otherwise, it is proved and it will give you good results. So my dear friends, if you like this video, do share and subscribe. Thank you.